Welcome back to How Companies Make Money. Today we're exploring one of the biggest healthcare companies in the United States, CVS Health, and how it has turned a simple pharmacy chain into a powerful healthcare conglomerate earning hundreds of billions of dollars in annual revenue. In this video, we'll walk through where CVS came from, how it expanded, what businesses it owns, how it makes money, and why its strategy matters in business and healthcare today. CVS Health started as consumer value stores in 1963, when brothers Stanley and Sidney Goldstein and their partner Ralph Hoagland opened a single store in Lowell, Massachusetts. The idea was simple: offer affordable health and beauty products to customers in a convenient retail location. Over the following decades, CVS expanded throughout the Northeast and then across the entire United States, focusing heavily on pharmacy services and retail convenience. By the 1990s, the company had thousands of pharmacies nationwide and was well known for its retail footprint. But the real transformation began when CVS shifted from being just a store selling products to becoming an integrated healthcare provider. Today, CVS Health operates through multiple major business segments, and this diversification is key to how the company makes money. Firstly, health services. This segment includes pharmacy benefit management services, often called PBM. Here, CVS manages prescription drug plans for employers, insurers, and government programs like Medicare and Medicaid. By negotiating drug prices and controlling distribution for millions of prescriptions, the company earns large, recurring revenue. Beyond PBM, this segment now includes Caremark pharmacy services, clinical programs, Oak Street Health, Signify Health, Minute Clinic, and other provider enablement solutions that deliver care in clinics, in patients' homes, or virtually. Secondly, pharmacy and consumer wellness. This includes the traditional retail pharmacies you see in thousands of locations across the country. CVS sells prescription drugs, over-the-counter medications, health products, vaccinations, and wellness items. These pharmacies also fill specialty prescriptions and provide care programs like vaccinations and health checks. Thirdly, healthcare benefits. Since acquiring Aetna in 2018, CVS has offered health insurance plans including Medicare Advantage, Medicaid plans, and commercial insurance. This became one of the biggest revenue drivers for the company because it means CVS earns money not just from selling drugs or managing prescriptions, but from insurance premiums and health plan management. By operating in these three major segments, CVS Health is more than a pharmacy. It's a full-service healthcare enterprise that touches care, insurance, medication, and clinical services. A key part of CVS's growth strategy has been strategic acquisitions, buying companies that add new revenue streams or support its long-term vision. Here are some of the biggest moves. One of the biggest historical shifts was the acquisition of Caremark Rx in 2007. This deal turned CVS into a leader in pharmacy benefit management, significantly expanding its influence and recurring revenue base. Although the price was not publicly disclosed, CVS added Minute Clinic walk-in medical clinics inside its stores. This began CVS's move into frontline healthcare services beyond prescriptions. CVS acquired more than 1,600 pharmacies and clinics from Target, expanding its store footprint and patient access. CVS bought Omnicare for over $12.7 billion, bringing long-term care pharmacy services into its portfolio. This was another step toward comprehensive pharmacy services. Long's Drug Stores acquisition added more retail reach on the West Coast. CVS acquired Signify Health for approximately $8 billion, adding in home health services and further value-based care offerings. The most recent major purchase was Oak Street Health for about $10.6 billion, bringing primary care centers across multiple states under CVS's umbrella. Oak Street operates dozens of clinics in more than 20 states, focusing on preventative and value-based care for Medicare patients. More recently, CVS launched a new subsidiary, Cordavis, aimed at working with pharmaceutical manufacturers to bring biosimilar products, lower-cost alternatives to high-priced biologics, to market. These acquisitions didn't just increase revenue, they expanded CVS's capabilities, services, and customer base, transforming it into a multi-layered healthcare business. Today, CVS's operations spread far beyond its first store. CVS operates over 9,000 retail pharmacies across all 50 U.S. states, the District of Columbia, and Puerto Rico. Many include Minute Clinics or health hubs that provide basic medical care and vaccinations right where customers shop. Through brands like Oak Street Health and Signify, CVS is expanding medical clinics in multiple states. Oak Street alone operates hundreds of primary care centers focusing on Medicare patients, with plans to grow even further. With Aetna, CVS Health enrolls millions of customers in health plans, including employer-sponsored insurance and Medicare Advantage plans. This further expands the number of people whose healthcare spending feeds into the company's revenue. CVS's diversified services all create revenue in different ways. Prescription drugs, over-the-counter products, vaccines, and wellness merchandise generate consistent sales at physical stores and online. Through CVS Caremark, the company earns fees from managing drug plans for millions of customers. This is one of CVS's largest revenue contributors because it processes prescriptions and negotiates prices across the healthcare system. Premiums from health plans under Aetna, including Medicare Advantage and commercial coverings, bring in recurring income alongside services and care costs management. Primary care clinics, in-home care services, and minute clinic visits generate service fees. As care shifts toward value-based models, CVS earns based on quality and outcomes. With Cordavis and specialty pharmacy services, CVS addresses high-cost drug markets with lower-cost alternatives and specialty distribution, another revenue tier. In 2023, CVS Health reported total revenue of approximately $357.8 billion, a substantial year-over-year increase from the prior year. The health services segment, which includes CVS Caremark and other clinical programs, generated nearly $186.8 billion in revenue, accounting for more than half of total sales. Across other periods, the company's total quarterly or annual revenues often range well into the tens of billions of dollars, reflecting consistent growth in retail, insurance, and pharmacy operations. So why does CVS Health matter? Because it shows how a simple retailer evolved into an integrated healthcare leader by expanding into insurance, clinical care, pharmacy management, and value-based health services. Its story teaches business lessons about diversification, strategic acquisitions, and vertical integration toward higher revenue and resilience in changing markets. If you found this breakdown valuable and want more deep dives into how major companies make money, hit like, subscribe, and turn on notifications so you won't miss future videos.